Recording to this computer, and we're on. Hello, everybody. It's Dr. Connors. This is the 12th of December, getting ready for Christmas, and going to go through some questions on today's Zoom call that people have sent in, that have emailed in. So let's just jump right to that so we can open it up for questions. One question was, I'm contemplating going for an IV drip of vitamin C while continuing use of the Rife machine. Please advise your thoughts on this. So remember on what we've spoken about with IV vitamin C and chemotherapy. So if you are doing chemotherapy, you may want to inquire about using IV vitamin C with chemotherapy to your oncologist. However, remember what I've spoken about with this in the past. IV vitamin C, so vitamin C in very high doses actually acts as an oxidant. That's the current belief right now. So vitamin C in normal doses, 1,000 milligrams of vitamin C, is an antioxidant. Therefore, oncologists typically do not want you to use vitamin C while you're doing chemotherapy, because chemotherapy is an oxidizing agent. And if you're using antioxidizing agents while you're using an oxidizing agent to kill cancer, then it's a little indicative. However, high-dose vitamin C, the current belief is that it's actually acting as an oxidizing agent. So I don't think there's a conflict of interest in doing high-dose IV vitamin C while doing chemotherapy, but you may want to consult with your oncologist. If you are not doing chemotherapy, then by all means you could do IV vitamin C, and that actually acts like a chemotherapy, and it certainly doesn't impede anything with the Rife machine or anything else you're doing. So I'm a big fan of vitamin C IV, so go ahead and do it in my book. Other questions. Ever since chemotherapy, I have had a salty taste in my mouth. Can you recommend or comment on what might be the cause? So remember, your taste buds taste certain flavors, right? Bitter, sour, salty, and sweet. These are, your taste buds are simply receptors on your tongue. So if you have damage to those receptors, you're not gonna have that taste. So the most common cause of loss of taste or loss of certain tastes, which would accentuate other tastes following chemotherapy, is the chemotherapy's damage to the receptors, the taste buds themselves. So chemotherapy can damage your taste buds. So it's very common where people will say, oh my gosh, after I did chemotherapy, I can't taste a thing anymore. Or after I did chemotherapy, everything tastes bitter to me, or everything tastes sour to me, or everything tastes sweet to me, or everything tastes salty to me. And that is because if the other receptors were damaged and the salty ones weren't, things are going to taste much more salty to you. Unfortunately, there's not a whole lot one can do to that except stimulate those receptors. So from a functional neurological perspective, a person could, so you could take this picture right here or Google one yourself, and you could take a sour substance and put like drops of lemon juice on this part of your tongue here to stimulate those receptors. So from a functional neurology perspective, the more you stimulate a nerve, the more you stimulate a receptor, the more that receptor is going to turn on and fire that neuron. So if you can put something bitter here, something sweet here, something sour on the edges here, you can stimulate those receptors and hopefully gain those taste buds back so not everything tastes salty. So that's one thing from a functional neurology perspective you could do. The other thing you could do is to help detox the chemotherapy, and that is doing the foot baths, doing liver cleanses, making sure you're doing your coffee enemas, do castor oil packs over the liver, do everything you can to get out that toxin so that you don't have any further damage to your any cells whatsoever. We had a question come in on the on the chat that says, where can I find IV vitamin C available locally? Well, you will have to search for that. You'll have to do a Google search for that. There's a lot of different IV centers that are popping up all over, but they're typically in higher population metro areas. And they do use, you can get IV vitamin C for them. They're typically kind of marketed to not so much cancer patients. Matter of fact, they're really not marketed to cancer patients at all. They're marketed to people who are like wanting to do an IV drip after a hard day out partying, or wanted to do an IV vitamin C drip because they feel like they have a flu coming on or something like that. So they're marketed more to the executive situation. So, but there are some clinics and some franchises that are popping up all over the place. In the Twin Cities, we have multiple that are new in the last 6 months, and you could Google search your area. Next question. I've noticed my hair falling out. I blamed it on age at first, but it's getting worse. My hairstylist believes it is becoming more serious, seeing that after my hair is shampooed, I had a bunch of hair in my comb. So what causes hair loss? So the most common cause of hair loss, other than somebody doing chemotherapy that damage the hair follicles and you lose your hair. So let's say I'm not doing chemotherapy. Why would I possibly have hair loss? The first thing that you think of from a functional medicine perspective is thyroid issues. So that's the first thing you want to investigate. Hypothyroid or high TPO antibodies, where you have Hashimoto's, which is an autoimmune thyroid, will cause hair loss, and you will get a lot of hair loss. So that's the first thing you want to investigate. How would you investigate it? You need to get your T3. These are thyroid, this is a thyroid test. So a complete thyroid workup would be taking T3, free T3, T4, free T4, reverse T3, TPO antibodies, and a TSH test. So if you get that back, if you could get that done locally, if you have an issue with hair falling out, the other symptoms that you'd have with Hashimoto's or hypothyroidism would be fatigue, would be weight gain, would be difficulty losing weight, would be a slow metabolism, would be with Hashimoto's, you can have episodes of increased thyroid, which could be racing heart, irregular heartbeat. So there's a lot of different symptoms that can be involved with thyroid dysfunction. And getting a good thyroid panel can be beneficial. We could take a look at that and see how we want to treat that. It can be tied to iodine deficiency as well, but that does tie to thyroid function. So you could have more of a functional hypothyroidism, so getting an iodine checked might be valuable too. There are some obviously other issues with hair loss, alopecia type hair loss, where you have an autoimmune attack to the hair follicles themselves. That's a little bit different. You would lose hair elsewhere in your body too, not just head hair. But that would be the most common issue with hair loss. Next question, we had somebody send in some labs, and what would be abnormal about these labs right here? So you look at red blood cell is low, and RDW, that's red cell width, is increased. So very common with early anemia. So an anemia is a decrease in red blood cells, hemoglobin, hematocrit, and these red blood cell functions here. This would be an early anemia, meaning that the only thing that's changed is the red blood cell and the red cell width. Very common for the red cell width to increase. So the red cells are actually enlarging themselves in order to be able to help carry oxygen and iron. So very common with early anemia. So what are causes of early anemia? Well, there's multiple causes, but if this person has just finished chemotherapy, that's probably your number one cause. So, and that was the case with this person. So as they clear out and detoxify that chemotherapy, I'm assuming this is very close to normal here, but it is at the low end. So I'm assuming that this should recover just fine. Same thing with this. These are liver function tests. Your alkaline phosphatase and your alanine aminotransferase, these are liver function tests. Both of these are high. Now, liver function tests are not indicative of any specific disease, but it does tell you that there's things going on in your liver, but nothing specific. So these tests would be high if a person had metastasis to the liver. But they'd also be high if you just finished chemotherapy and you have a whole bunch of toxins going through your liver. So that would be pretty a normal reading post-chemotherapy here. So I'm not concerned with that. These aren't exorbitantly high anyhow. But definitely, given this person just finished chemotherapy, this is most likely a function of that and detoxifying. So this is where you go, boy, we really want to make sure we're doing coffee enemas, make sure we're doing castor oil packs over the liver, hot pad over the liver, saunas, everything that we can to help liver detoxification, milk thistle products supporting PON1 pathways, etc. Really important for this. Okay, I am going to unmute everybody and open it up for questions. Feel free to pipe in.
This is Sharon. I've been hearing lately a lot about doctors who take hair samples and then they provide different analysis. Like for one example would be my daughter's friend. They were able to do some analysis about what kinds of foods to stay away from, like which, like similar to what you do, but you do a more thorough job and more scientific. And then another one is like testing for heavy metals and kinds of things that are in your body that may be toxifying. Is that legitimate?
Okay, I'll mute you and everybody, and then I will answer that. Okay, hair sample testing has been out on the market for decades. It has been improved upon as far as the test itself goes, but the problem that it has problems too. So the problem that I have with hair analysis testing is that there's other things that affect the test. So if you are using, everybody uses shampoos and there's chemicals in shampoos. If you're a woman and you're dyeing your hair, now obviously if you've seen me, I dye my hair gray. So that has chemicals in it as well, that affects the test. So there's things that can skew the test. Secondly, it's a test that's going to measure something in the past. And it has been shown through multiple studies that heavy metals especially can come out in the hair follicles and can be expressed in hair samples. But you're looking at where it was at several months ago, right? Because it took months for that hair to get there. But there's just a lot of gray area with it. So I personally have never been a big fan of hair sample testing. The problem is how else do you test for heavy metals? Well, first of all, hair sample testing for foods, I think, is not accurate at all. Hair sample testing for heavy metals can be accurate, but there can be skewed data with that. So I've never been a big fan of it. The problem is that what other way do you test for heavy metals? And the other test is what's called a provocation test, where you actually give a person a high dose chelator, higher than they'd be able to really pull out of the body. And so you give them EDTA or DMSA, high dose the night before, and then you do a 24-hour urine collection starting in the morning. And then you're looking for In the urine sample, then you're looking for heavy metals that have spilled into the urine because they were circulating in the blood because the chelator dropped them. That will give you a more accurate test of heavy metal toxicity. The problem is you risk making the person sick doing that. So you gave them more chelating agent than their liver can really handle. You pull a whole bunch of heavy metals out of the tissues, and then because the liver can't handle getting rid of all that, it spills into the blood and through the kidneys, and you urinate it out. Well, that doesn't seem like a real smart idea if you really like that patient. So I tend to like my patients, so I don't do that test either. So how do then you test for heavy metals? That's where you get down to where kinesiology is the least invasive way to test for heavy metals. But one could even make the assumption that you definitely have heavy metals. Everybody's got heavy metal toxicity. So do we really need to test for it? Especially when, if you're going to treat it, your treatment basically is going to be indiscriminative to whatever heavy metal you're to. It's not going to discriminate against a specific heavy metal. So do I need to know that I have aluminum toxicity is the worst, or do I need to know my mercury toxicity is the worst? When I'm going to use a product like Clear that's going to pull out all of it anyhow, you know, if I'm going to use a chelator, a modified citrus pectin that will help pull out heavy metals, it doesn't make any difference whether I am high in aluminum or I'm high in mercury or I'm high in uranium. It's not going to discriminate against which one. It's going to pull all of them. So do I need to know that data? It gets back to do a test if it's going to change the way you treat the patient. But some people need to have something hard written paperwork that gets them to take the chelator to help detox. Some people don't. Some people can understand that. You know, I could assume that all of us have heavy metals. While I have you muted, I had another question come in on the chat. It said, avoiding beans due to histamine, but read that bean sprouts are actually histamine scavengers. Yes, that's true. So beans themselves are moderate in histamine, moderate to high. So if you're really on a low histamine diet, that's something that you're going to stay away from, maybe not all the time, but you're going to watch your consumption of that. But bean sprouts don't have histamine in it. It's very similar to barley greens or even wheat greens. Wheat has gluten in it, right? Barley has gluten in it. But the sprouts don't yet have gluten. So you can have barley sprouts and you can have wheat sprouts, but you can't eat wheat if you're staying away from gluten. So that's just the different things about food that are interesting. So yes, you could use bean sprouts. They can be histamine scavengers. They can be good for you in a lot of ways. So bean sprouts are good choice of food, and growing your own can be fun. Okay, I unmuted you, so if anybody else has another question.
Dr. Connors, this is Deb Schwartz from Ohio. Anyway, I was watching your turmeric video. Did you muscle test us if we need turmeric, or should we just order it and take some?
I muscle test everybody. So when we do kinesiology, curcumin is one of the things that we test everybody for. But if you didn't test for it, could you still take that, and could it still be beneficial for you? The answer is yes. So turmeric, the active ingredient of turmeric is curcumin, and curcumin is anti-inflammatory, anti-cancer. It is good for a lot of different things. So yes, that could be a good plus for everybody. Remember, when you're taking turmeric, some people go, I'm just going to go down to the local co-op and buy ground turmeric and take that. If you do that, remember that you have to take it with a fat. if you're just taking ground turmeric,
Yeah.
you have to take it with a fat. So you could cook with it and make fatty dishes with it, use coconut oil, and it's better, you'll increase the half-life of it if you also take it with pepper, with black pepper. The turmeric that we have is the tetrahydrocurcuminoid, which is a type of curcumin that you do not need a pepper with it to increase the half-life, and it's already pre-emulsified in a fat. So our CurcuClear has already got that in there, and each capsule is about equivalent to 1,000 milligrams of that. So that makes it easier. We have somebody with their hand up. I believe that's Burley.
Yep. Hi, Dr. Connors.
Hello.
Hello.
Yes.
Oh, hi, Dr. Connors. Can you hear me?
I can hear you. You go ahead.
Oh, I have a couple of questions. You know, I've been there approximately a month ago in your clinic, and I'm using the right machine. I'm doing everything, I think the coffee enema, everything. And suddenly, a couple of days ago, I started to feel very, very bad. And I just checked it out. It's probably all of it for the cleaning, the body, you know, the cleansing. And I have a terrible headache. I'm trying to hydrate myself. I don't know what else to do. I'm making a lot of. I raised my coffee enema from 1 to 2 every day.
Uh-huh.
And I have infrared sauna with ozone in it.
Okay, good.
And I just don't know how often I should do that because, you know, I started to sweat, which I haven't did in ages. I think never ever sweat in my whole life, but I'm sweating. And I'm just wondering how often I should make this sauna because I'm afraid I'm getting dehydrated. I was dehydrated anyway.
Well, we don't want you to be dehydrated, so make sure you're drinking water. And if you're doing a sauna every day, you might want to add some minerals as well.
But I'm taking calcium and salt, and I have formic acid and humic acid. You tested that for me. It was very good for me according to the kinesiology.
Yes.
So I'm taking that. But yeah, I just don't know. I hope I'm doing well. Oh, my other question: can I cut it off the time? How long I taking? So I have the program, for example, 9 hours. But sometimes I wake
life
up
program. So sometimes you're only getting 7 hours in. It depends on how long you're sleeping.
Yes.
Yeah,
yes.
that's fine. That's fine.
Okay, good. Because I felt, and I put it a little bit farther from me, the bulb, because I think it was too much for a while. So I just take it away. I don't know, maybe a half a meter or a half a feet.
Okay. Yeah, that's fine.
And I am moody, and I hope I won't get depressed. I would love to ask if you. I didn't get my result of the thermography yet.
Okay, I'll have Angie reach out to you then.
And I don't know about the genetic test. It's not there yet, am I right?
We didn't get that back yet.
Okay. And I just wondering, because I don't like to keep my computer on Wi-Fi, you know, I don't want any malware or whatever get onto it. So I just trying not to have it on Wi-Fi. How can I update or how it is updated?
Well, you really only need to update the frequencies every 3 to 6 months.
Oh, I see. So I shouldn't.
I don't suggest you keep it on Wi-Fi on a regular basis. You don't need that going through that machine.
Yeah, I don't. I have other computer to use. So, yes, okay, thank you. So I don't need to worry about
updating. No, especially when you're mainly just using the program that we created for you. Even if you update it, it doesn't change that program. So You don't need to update it unless you're using a lot of different programs and you're looking for the latest flu program or something like that. But that's not.
Yeah, I already used that once
Yeah.
because I thought maybe I have the flu, but probably
And I would, if you were doing everything and you haven't felt sick, and then you all of a sudden you kind of feel really sick, you might have a virus. You might want to run a strep program or a flu program or that viral complex program. That seems to work real well. You know, you could be coming down with something. So.
Okay. Oh, and I read, for example, I should make a liver gallbladder flash, which I don't know what's that.
Well, you don't necessarily need to do that. I did post the liver gallbladder flush on the Facebook page today because somebody else asked about it.
Oh, okay.
And we could email it to you as well if you need.
Okay. I will check it on Facebook, but thank you. Thank you very much, Doctor.
Oh, you bet.
Thank you very much. So I think so far that's all. I always have a million questions.
That's okay.
Thank you very much. I'm waiting for Angie's email about the thermography, and have a wonderful day for you.
Perfect.
Thank you. Bye-bye.
Bye-bye. Any other questions today? No? Well, thank you very much. I hope you guys have a good weekend and stay warm and do all your Christmas shopping. And I'd highly recommend that if you do go to a movie, the new Grinch movie, not this one with Jim Carrey, but the new one that's out is very kid-friendly, very cute little story. So recommend that as well. All right, you guys, thank you very much. I will sign off. Bye-bye.
Bye.
Thank you. Have a blessed day.